I'm Dr. Reuben Sloan, and welcome to our next podcast, Back Talk.
Hi, I'm Dr. Michele Perez, and I'm joining Dr. Sloan here today on our next edition of the podcast. So, Reuben, tell us about how everything got started. We're going to talk about the history of the Spine Center at Resurgens Orthopaedics today. And you're the, as we like to say, the OG, right? You were the first physiatrist. So maybe we should define physiatrist first, right?
So
we always
yes,
have to do that, right?
Always, because nobody knows what we do.
Nobody knows.
So I was the first physiatrist with Resurgens Orthopaedics. I came here in September of 1989. I was doing the same thing in Columbus at the Houston Clinic in Columbus, Georgia. So for me, it was just an easy transition. I went from one big orthopedic group to an even bigger one. But what I wanted to do was to bring the non-surgical orthopedic model to Resurgens. And fortunately, the two head doctors at the time were also interested in the same thing. So we got connected, and I was hired on the spot. And before you knew it, I was put in charge of creating a spine center with a couple of the other surgeons. And before we knew it, we had 30 doctors, 15 physiatrists, and 15 surgeons that were covering all these different offices, providing top quality spine care to Atlanta. The way it started was we wanted to make sure that if somebody saw me or some other doctor in any other office, they were basically getting the same care. So we started with protocols. If somebody came in with this condition for this many weeks, we had sort of a flow chart to follow so that we ensured that people were getting the same care regardless of who they saw or when, where they saw them. And it was great. Everybody loved it. The insurance companies started getting interested in what we were doing, and they started using these protocols too. And now they kind of haunt us.
So how did they find you? Who was it that found you?
So I actually found them. So
Okay.
I wanted to come to Atlanta because I grew up in large cities, and New York and LA, and I wasn't comfortable in Columbus because it was just a little too small for me, and Atlanta seemed like a perfect fit. So I was dating a woman who was a physician, and I asked her if she knew of any practices similar to what I had at the Houston Clinic in Columbus, and she knew of Resurgens, and she put me in touch with Blaine Woodfin, who was the president then, and the rest is history.
Gotcha.
26 years later.
And then we were talking earlier about how many came along before I did. I didn't realize I was the fourth one to come through. So Did you hire Crystal Chambers?
So I did not. So I had a hand in hiring almost every other physiatrist that joined us other than Crystal Chambers, who was physiatrist number 2 and is still with us after 25 years. Somebody knew her. Somebody knew of her in the group. And I got so busy so quickly, and there were things that I just didn't do that she did, that it was a natural fit for her to come join us. And before we knew it, she got crazy busy.
Right.
And we found a third. And then
you guys were both at the original St. Joseph's location, right?
She was at the Roswell location.
Okay.
And then she came to St. Joe's. And then you spent time with me as a resident when you were with Emory.
Right.
And I always asked to have the senior residents come spend time with me if they wanted to on elective time at Emory. And most, if not all of you did. And, I was not stupid. I made sure to keep an eye on the best and the brightest of the class. And I would often offer you guys jobs, and hence the reason you're here.
Right.
And you've been with us now, 22 years?
22 years. This year is going to be 23. Yeah.
Right.
So, and I knew it was a good fit from the beginning. I remember walking through the clinics at St. Joe's and just it was just a really welcoming environment in general. You were so kind. Lori Elwood was so kind. Everybody was just friendly. And, because when you're a resident, you're not very sure of yourself, and you don't know what your job's going to be like and your career is going to be like. Some people have that path kind of laid out. I didn't. And I remember coming over to Resurgens, really loving it, had my mind set on it. And I interviewed with another clinic, which we won't name, in Atlanta, and it was a terrible experience. Just the interview itself was terrible. And I think I called you guys the next day and just said, "Yeah, I'll be there." So
I remember.
and that was it. And there was just a little bit of unsurety at first about which offices I was going to cover because we needed so much coverage. I remember that was just, we weren't quite sure where I would go because everywhere in Cobb needed coverage,
Right.
Cherokee needed coverage. And, sometimes patients will ask me, which offices do I cover? And I'm like, I've covered every single one of them,
Right.
from Canton down to Windy Hill. I mean, I even covered Windy Hill for a little while.
Right.
So
When I started, I covered 4 offices all over Atlanta, and it just got to be too much.
I did, yeah.
Which was one of the motivations for hiring other doctors to expand the offices that I wanted to vacate.
Yeah, I mean, just in our region alone, we have so many offices that we cover through Cobb County and Cherokee County, and
Right.
and luckily, we've had to hire on some more folks like Robin Dennis to help cover the area. We had Julie Levine, yet another Emory grad, come in with us, and yeah, so it's how many we have now? 15?
13?
13 now?
Yeah.
Okay.
It got up to 15.
Yeah, for a little while there. Okay. So I don't even know did we say what a physiatrist was? I think we skipped over that.
So we did. Sorry. So it's funny. I joke that my mom does not even know what a physiatrist is, and I've been one now for 30 years. So physiatrist is often confused with podiatrist or psychiatrist, and we're not either of those. Physiatry, in essence, at least what we do at Resurgens, we're non-surgical orthopedic doctors, where we do everything an orthopedic surgeon can do except surgery. So when people learn that I'm non-surgical, when they come see me, they assume I'm orthopedic, so I'm with a massive orthopedic group. And when I tell them what I do and what my field is and that I'm non-surgical, they just light up. There's a huge smile on their face because they know they're never going to get surgery with me. And the only way that I would recommend surgery is if they absolutely need it. So
Sure.
they love that.
Yeah, I mean, we have a unique practice. Not many practices have physiatrists. Either they're on their own. There's not many with the blend. Certainly not the numbers or the volume that we have.
Correct.
And like you said, I mean, they get super excited. They go on and watch our videos and they get super excited because they're scared that they're going to be told that they need surgery. But what they then see when they get there is if they do need surgery or if they have seen the surgeon, that we know each other. We are not working on islands. We know each other. We see each other routinely. And they know that if I send them to Dr. So-and-so for surgery, I know what they're getting into. And
Right.
they know that they can make a U-turn and come back to me again.
Correct.
It's they can go around and utilize whatever services they need. So to just kind of explain to people how it works in our practice, most people who call in to get an appointment for a spine problem will get sort of, I guess, filtered to us usually first. And we do the workup, do the diagnostics, do as much care as we can, and then usually we'll refer to the surgeons. And that's the way the surgeons like it too.
Correct. So that's the ideal situation. Sometimes it doesn't happen that way.
Sure.
And the other thing which you mentioned is the continuity of care is really important. So when we get somebody who needs more than we can do for them non-surgically and they really need to be considered for surgery, the continuity is there.
Right.
Everything is in the chart. The doctor who's in our practice can look at the chart, can look at the x-rays. They can come talk to us if there's any questions. So it's seamless. And that's exactly what we wanted when we did this 26 years ago.
Right.
We wanted one-stop shop.
Yeah. So I
we
guess
have
to
it.
explain to people, Spine Center is really just kind of an entity we named as part of the larger practice. Like we're still
Correct.
part of the whole practice, a seamless part of the practice, but we have physiatrists, we have spine surgeons, and then we have a multitude of orthopedic surgeons in different subspecialties. So we just kind of categorize ourselves as the Spine Center because we have similar knowledge with the spine surgeons and the other physiatrists, so we can have meetings and kind of coordinate ourselves as a smaller subgroup.
And educational meetings. And then the most important piece, which we haven't even touched upon, is physical therapy. So that was the third very important piece to the puzzle that we needed to be there. And we needed therapists who spoke our language, that looked at things the way we do, and did something not so much outside the box, but did something a little different than the run-of-the-mill therapist. So for us, it was hands-on therapy, manual therapy. And, this picture shows it here, where we had all of these back talk magazines back in the day before everything was digital. And this picture shows how the therapist that we hired, who just retired after 25 years, had a very hands-on approach, manual therapy as we call it, arthropraxis is the other word for it, and it helped people get better faster because they were not only getting therapeutic exercise instruction, which is the run-of-the-mill therapy that most people associate with therapy, they were also getting some form of mobilization.
Right.
So a gentle manipulation, if you will, but not quite as extreme as a chiropractic manipulation.
Right.
And it's extremely therapeutic, and people see results very quickly. And historically, that's been one of the issues with physical therapy. People get frustrated because they're not seeing results fast enough. So when we blended it with manual therapy and therapeutic exercise, people were getting it.
And then it all ties in with their advanced training that a lot of our therapists have been through, McKenzie training,
Correct.
The extra level that they've gone to specifically for spine, which is, very specialized.
Right.
So.
Yeah, directional preference, where they would ask people to move in different ways and see how they preferred to move, where there wasn't pain that was reproduced, and then they would build an exercise program on that. I mean, that's it, and that's nuts and bolts. And other people have taken our concept and ran with it, but we were, if not the first, one of the first in the Southeast.
Yeah, I still don't think anybody's as big as us, though, as far as the number of physiatrists.
No. We did not have this in Columbus, at the Houston Clinic, and they might have it now, but I don't think they do. It was a revolutionary idea to have this level of cooperation and education, because we used to have educational conferences, physical therapy, protocols to make sure patients were treated properly, and everybody was happy. Again, including the insurance companies, which was not our goal, but they loved the protocol idea, and they actually had us come teach them how to make protocols. And now they're using those protocols to deny claims, sadly.
But the continuity is because we don't lose those people. They're in our offices to see us. They're in our offices to go to PT. They're in our offices to see a surgeon if they have to get their nerve study done. They're in our surgical centers to get their procedures done. And they're seeing our nurse practitioners and physician assistants if they have to. It's all in-house. There's rarely anything that has to leave the house.
Correct.
Yeah. So.
That's right.
Great job.
Thank you.
Okay.
So that wraps up our podcast on the origins of the Spine Center. Thank you.
Thank you for listening.